My name is Jessica, and I'm a solicitor and I'm also a full-time mum. I started having problems with my knees about 3 years ago. I twisted my knee and I went and had it looked at, and apparently I had torn the outer meniscus in my knee. So I had a menisectomy, and then I tore it again, and I had to have another arthroscopy, another menisectomy, and now I have got osteoarthritis in that knee, and that's a consequence of both the tear and probably having this discoid meniscus, because it means your knee doesn't ever work properly, it never has done. And then about 18 months ago I started having pain in my left knee, and I found that I had torn the inner meniscus, and I have to say that was the most painful knee. I found it very difficult to go up and down stairs. I had a lot of pain going upstairs. I had trouble swimming because you can't do breaststroke when you have bad knees. You have to try and do crawl, and I just found the whole thing quite painful. If I did a lot of walking, it would get painful. I had a lot of night pain, used to wake me up. I would take painkillers and they didn't really help, and I found that if I tried to use an elliptical trainer, which I quite like, I get knee pain from that. So it was quite restricting, and I could only see it getting worse, not better. And then last August I went into hospital to have another menisectomy on my left knee, and for various reasons I couldn't have the operation, so I was sent back to my room, and I had to pick up a copy of a newspaper, and there was this advert for AposTherapy, and I thought, funny name, I'll think about that. So I stored that in my mind, went home, and the next day I just thought, because the pain by this time was very, very bad in my left knee, and it was quite bad in my right knee. So I just googled Apos, so I went and made an appointment. So the operation should have been on the Thursday, and by the next Thursday I had my Apos shoes fitted. And I can honestly say that they helped right from the start, even just wearing them in the clinic. I came out and I walked up the steps of the tube, and I found I could actually walk up a set of stairs without any pain. And it does seem extraordinary, that's from a pair of shoes, but it's absolutely true. And basically my knees have got better and better since then. I can now go up and down stairs, I never get any pain. I very rarely get any night pain. And it does seem extraordinary that a pair of shoes can change your life like that, but they definitely do. And so far, a year and 2 months on, I haven't yet had the operation, so that's really good. And I'd really recommend them to anybody, because at the end of the day they're a pair of shoes, and if they work, that's good. And you haven't taken any drugs, and you haven't had any surgery, and you know, it does seem incredible. It's almost too good to be true, but they really do work. And I don't find them any sweat at all to wear them. And I just wear them like slippers for the hour or whatever you're supposed to wear them. Or you can break it up and do 2 half-hour sessions, so it's very flexible. Yeah, no, I'd really recommend them.